एक second, don't scroll past this. Look at the sky right now, or a plain white wall, or even your phone screen with the brightness all the way up. Do you see them? Tiny black dots, threads, a cobweb shape drifting just outside where you are looking. You try to stare at one and it moves away. You chase it and it runs. Almost every person I've seen in my clinic has experienced this. Almost all of them said the same thing. मैं सोच रहा था अपने आप ही ठीक हो जाएगा. And here's what I need you to understand today. Sometimes that is completely true. And sometimes it is the last warning sign your eye will give you before serious permanent damage. I'm Dr. Surbhi Kapadia. In the next few minutes, you will know exactly which one you are dealing with. So let's start from the beginning. What are these things? Inside your eye, there is a gel called the vitreous. When you are young, it's completely clear, like pure transparent glass. But as we age, and this can start even in your 30s, especially if you are nearsighted, and this gel slowly starts to break down. Tiny fibers inside it clump together, and these clumps cast a shadow on your retina. That shadow? That's the floater you are seeing. It's not dust on your eye, it is not your glasses, it's inside your eye floating in the gel. And that's why you can never look directly at them. Jitna dhoondte ho, utna bhagte hain. Because when your eye moves, the gel also moves and the floaters drift with it. Now, if you have floaters that have been around for months or years, they are small in number and your vision otherwise feels completely normal, just breathe. ये normal है, part of aging. It happens to almost everyone near 40. Nothing to panic about. But there is a second version of this story, and that is what I really need you to hear. रुक जाइए just for a second. Everything I just told you was about the floaters you already have. The old ones, the familiar ones. What comes next is about something new. And new is the word that changes everything. Tell me, have you ever seen a flash of light in your eye, like someone just clicked a camera inside your head? Or a sudden flicker at the edge of your vision, even in a completely dark room? That is not just a floater, that is your retina being pulled. Here's what's actually happening as the vitreous gel shrinks and breaks down over time. It can start to pull your retina, the thin, incredibly delicate layer at the very back of your eye. When it pulls, the retina sends a signal. Your brain reads that signal as the flash of a light. Most of the time, the gel separates clearly, no damage, you're fine. But sometimes, and this is the part I need you to sit with, it pulls hard enough to tear the retina, like a piece of cloth being stretched too tight and then ripping off. And here is a number I want you to remember. 10 to 15% of people who suddenly experience a shower of new floaters with flashes, they already have a retinal tear. Right at that moment. No pain, no redness, आंखें बिल्कुल साफ दिखती है बाहर से. But inside, the clock has already started ticking. 3 signs, सिर्फ 3. If even one of these happens to you, please do not wait. Sign number 1, the sudden burst of many new floaters. Not the 1 or 2 familiar ones you've had for years. A shower, sudden, new, many at once. Like someone scattered black pepper across your vision. Sign number 2, repeated flashes of light, especially in a dimly lit room. Especially when you close your eyes, not once, repeatedly. Sign number 3, and this is the most serious, a shadow, creeping in from the side of your vision जैसे side से कोई पर्दा आ रहा हो. Slow, dark, like a curtain falling off. That curtain, that is retinal detachment. The retina has already begun to lift from its position. And the truly frightening thing, ये दर्द बिल्कुल नहीं देता. No pain whatsoever. I've had patients come to me a full week after the symptoms began because they were waiting to see if it would go away on its own. By that time, the macula, the part of the retina which is responsible for your sharpest, most detailed vision, was already damaged. So what do you do if you see any of these 3 things? You go the same day, not tomorrow, same day. And when you get there, be specific. Tell the doctor, I have sudden new floaters, I am seeing flashes of light. Please examine my retina with dilatation. Those words matter. If there's a retinal tear and we catch it early, we treat it right there in the clinic. A laser procedure. No cuts, no surgery, no hospital stay. It is done in minutes. Painless. But if you wait and a tear becomes a full detachment, now we need surgery. And even after surgery, sometimes the vision does not fully come back, especially if the macula has been involved. नजर एक बार जाती है तो वो पूरी तरह वापस नहीं आती. Please don't let it come to that. So here's what you take away today. Old floaters stable, vision otherwise fine, monitor them. Get a dilated eye examination once a year, nothing to panic about. But sudden new floaters, flashes of light or a shadow in your vision, that is your retina asking for help. Go the same day. Your eyes see every sunrise, every face you love, every moment worth remembering. They deserve that one phone call. If this video helped you, please share it, especially with someone over 40 or someone who's nearsighted, because the person who needs this most won't think to search for it. Drop your question in the comments below. मैं personally पढ़ती हूँ और जवाब देती हूँ. Take care of your eyes.